Okay, just a few slides on oxygen therapy to give you guys just a brief overview of some of the most commonly used oxygen delivery devices in the hospital setting. So, I think you guys realize oxygen is a drug. Oxygen therapy is considered anything that we give the patient that is above room air. You should understand that if abused, it can cause complications. Some of these complications can be oxygen-induced hypoventilation, which you might see, for instance, with the COPD, oxygen toxicity. There's no need to have someone sat at 100%. Absorption atelectasis, retinopathy. That is a big concern in neonates and infants. You guys will learn about that in pediatrics. It can obviously also dry the mucous membranes, and it is a fire hazard. So you have to ask yourself, why is the oxygen being administered? Is the need for oxygen therapy over? Is it time to wean? Hazards would be, the main thing I want to point out is that oxygen is combustible. And you need to realize that there is a high flow versus a low flow devices. Low flow are what we're used to, like a simple face mask, a non-rebreather, nasal prongs, where the oxygen delivery is inconsistent. It's dependent upon various factors, versus high flow, which is consistent delivery of oxygen therapy. And that would be, one example I'm going to give you is the Venturi system, which we're going to talk about. Okay, I think this actually might be a good slide that you guys could cut out and put in maybe like your clinical tablet or clinical notebook. It tells us about the different delivery systems. So you guys should know, for instance, that room air is 21%. So anything above room air or 21% then is an oxygen, considered oxygen therapy. So for instance, look, here's the nasal cannula. Some literature says it goes up only to 5, some says 6, but certainly not more than 6. So you cannot give more than 6 liters of oxygen via a nasal cannula. And so just 1 liter increases the oxygen concentration that we're delivering to 24%, as compared to 5 liters would be 40%. Now when you're looking down here, remember we talked about low flow and high flow. So the nasal cannula is considered low flow. Okay. Simple face mask, which we're going to talk about, if you set the O2 head between, for instance, 6 to 7 liters per minute, then you're going to get 50% delivery of oxygen. This is considered low flow. And then the Venturi mask, we're going to talk about that, but if you pick the one that delivers 24% and you set it at 4 liters versus the one for 40% and you set it at 8 liters, then this is considered high flow. And then we have the non-rebreather. If you set the non-rebreather, for instance, during an emergency situation when the patient is still breathing, between 10 to 12 liters, you can get greater than 95% delivery of oxygen. These are the ones that we're going to explore. We're going to talk about nasal cannula. Remember, it's low flow. Advantages is that it allows movement. It allows the patient to be more mobile. It doesn't interfere with speaking, doesn't make their voice sound muffled. So this is the nasal cannula. The Venturi system is this right here. And we're going to talk more about this, but it's a more precise. Remember, we said it was high flow. We're going to talk about that. And because it's high flow and more precise in what percent of O2 it delivers, it's best for COPD. And then the non-rebreather, which is this system right here, is the one that can deliver the highest concentration of oxygen therapy. Okay, the nasal cannula. Remember, for the nasal cannula that it can be set on a flow from 1 to 6 liters. So that means that we're going to set it between 1 to 6 liters. You're setting the O2 head between 1 to 6 liters. It certainly is an easy way and an inexpensive way to deliver oxygen. It makes it easy to eat and drink. Can be used with humidity when you get up to the higher liters, which is good because otherwise it can cause pressure sores in the nose, crusting of secretions, dry out the mucous membranes in the nose, and it can actually cause nosebleeds. And so when you get up to about 4 liters, it's not a bad idea to ask if we couldn't have humidification also. I just want to point out that the nasal prongs go in the nose, and then the tubing actually goes behind the patient's ears, and then the device that secures it goes under your patient's chin. The Venturi mask. The Venturi mask has valves. These valves right here are selected. They're different in colors. You can select the green one, for instance, which delivers 60% O2. So the green one delivers 60% O2. Or you can change out this valve for instance, with the blue one. And the blue one delivers 24% oxygen. And so this is a mask that fits on securely on the patient's face. The strap goes behind the head. You select the removable adapter or the valve that you want to put here. The doctor will order this, and then this will give a precise amount of oxygen. And remember, we said this oxygen delivery system was best for people who had COPD. The simple face mask just fits securely over the patient's nose. The strap goes behind the head, and you have exhalation ports. Don't ever cover those exhalation ports up. That's how the patient gets rid of the exhaled gases. Simple face masks typically are ran at about 5 liters. They're simple, they're lightweight. They can also be used with humidification, which will increase patient comfort. They do have disadvantages. A lot of times patients actually take them off when they want to talk to you. They have to take them off if they want to eat or drink. If someone's nauseous and vomiting, these are not a good choice. They have to take them off if they need to cough up secretions. They're very irritating. The mask, for instance, can ride up under the eyes and irritate the eyes. They can obviously dry out the mucous membranes if they're not used, for instance, with humidification. So they're not quite as comfortable. The non-rebreather is considered also a low-flow oxygen, though it can deliver a high percent. The main thing I want you guys to understand is this is the bag, and this bag must first be filled prior to placing it on the patient's face. Okay, so we fill this, and then once we've filled this, then we can place the mask on the patient's face. There are, depending upon how much oxygen you want to deliver, will depend upon how many liters you set this at. But for instance, during our seizure simulation, the patient was seizing, the patient was cyanotic, the patient's SATs were low in the high 70s, right? And so in that instance, you would want to set the O2 head between 12 to 15 liters, fill up the bag, and then place this on the patient's face. This would potentially deliver, as long as your patient is still breathing, greater than 95% oxygen to your patient. And every time they breathe in, they get a nice lift of oxygen that's in this reservoir bag right here. And so a non-rebreather is very effective in an emergency situation. You just must remember that the patient needs to be spontaneously breathing. As far as the advantages and disadvantages, they are the same as with a simple face mask.